I actually knew before anyone told me that I'd got cancer that there was something wrong, because the nurse before said, "I'm going to wheel you into a recovery room, but the doctor would like to speak to you." They were the words, and I remember it vividly. And as soon as she said that, I knew that there was something wrong. And yeah, they wheeled me to the recovery area, and I actually burst into tears because I knew, without anyone ever telling me, that I'd got something wrong with me. I'm Paul Woodhouse. I've worked in marketing for about 20 years, and I'm here to talk about my battle over the last year with bowel cancer. So I grew up pretty much in and around Cambridge for most of my life. I lived in Cambridge for about 9 years before we moved away to Colchester for a little bit. We always used to follow my dad. So we ended up moving around, and then around about 14, we were going to move to Peterborough, but I actually ended up moving back to the same village that I'd grown up in. So pretty much lived in and around the same part of the same village around Cambridge for most of my childhood before I went to university in Lincoln to study a journalism degree. And I always joke, and I do this in job interviews all the time actually, but I joke I'm a failed sports journalist because I always wanted to be a radio journalist. I studied wanting to get into radio and commentate or report on football matches. I did do a little bit of work, freelance work at one point with the BBC and Radio Cambridge, but I got a bit bored of not making any money and doing things for free all the time. So I then ended up getting like my first job in PR, writing press releases and articles. But I got made redundant after about 6 months of my first job when the company closed, which would have been awful when I was worried and didn't know what to do next, but actually was probably the thing that was the best thing that ever happened for my career, because I then ended up getting into marketing.
Are your parents local still?
My parents, so yes, my mum lives in the same village that I grew up in. Unfortunately, my father passed away in 2007 from cancer, weirdly enough. He had esophageal cancer, which was very aggressive and had spread quite a bit around his body. So unfortunately, he passed away quite quickly after he was diagnosed. But yeah, we've always sort of stayed relatively close. When I met my wife, we had a choice of living in Leicestershire or Cambridge, and we ended up sort of settling, and it's only about 10-minute drive away from her.
When did you meet your wife?
So one of my best friends from school, James, went to De Montfort University in Leicester, and he met his now wife, Liz, whilst there. And my wife, Leanne, is Liz's best friend from when they were at school together. So I met her through him and his now wife, and so the rest is history.
And how long have you been together for?
So, 19 years now.
When did you have children? When was it? How many children have you got?
So I've got two daughters, Maddie and Ella. Maddie was born in 2010 and Ella born in 2013. So they're 13 and 10 now. They are the greatest thing that has ever happened to me. I know it's a bit cliched, but everything I do is to bring them up, give them things, provide for them. I think it's when they become people. I know a lot of people say, the minute you see them, you fall in love, and it's scary, and you're very protective. And I'm a warrior. I definitely get anxious about things, and so for me, I wanted to hear them cry the minute that they were born and make sure they're okay. I was very protective. But I think I've just always grown to love them more as they got older. And actually, as soon as they start to get a little personality, they become people. That changed things for me. You start to really get to know them. And as they've grown up, yeah, they're just wonderful children who have their moments, but they are very sweet. They're very kind. I've noticed it a lot, actually, even in the last year. My youngest has been so caring and affectionate. My wife, her biggest ambition in life was to be a mum. And so that was something I always knew was going to be there for us. I'm quite old-fashioned and traditionalist, so having a family was always something that I wanted in life. Because you watch them every day and you think back and go, how have they gone from that little blonde thing to teenager now? And it scares me how fast it goes. But it's brilliant to watch, and I just hope I can watch them fulfill their lives and help them in that way. So the first time I noticed something was December 2021. I actually had COVID that Christmas, so it was probably the least thing in my mind because I was more worried about the fact that all my me and my daughter had got, that's around Christmas time, but probably mid-December, I noticed some blood after I'd gone to the toilet, and it had happened once before, actually, weirdly, a couple of years, or maybe a year before that, but it never happened again, and I was worried when I saw it, but I didn't do anything, and it didn't happen again, so I thought, oh, it must be a one-off. So when it happened in that December, I sort of thought maybe it was the same thing, but it lasted a bit longer, for possibly about a week to 2 weeks, and then Christmas came and went, and the other side of the New Year I'd started to notice it less because it was very obvious, very apparent, quite bright in colour, but like, whether it's a stereotype, but as a true man, I just hoped it would go away and thought, oh, it's nothing, and didn't really deal with it. I should have gone with hindsight straight away to deal with that. I went at the end of March, me and my fellow directors in my old job went to Manchester, and we went for a night out, had us some food, and I felt that I was very bloated. I could eat like a horse, but it takes a lot to make me feel full up and full. But I that particular night, I felt incredibly bloated and tight in the stomach. I started to put a couple of things together, and I don't actually think I realised about how my bowel habit had changed until after I was diagnosed. But when I look back, things were different in the frequency I was going to the toilet and how it was coming out, for want of a better phrase. That happened again on my birthday. So my birthday's in early April, and I went out after watching football. Again, a few drinks, felt a bit funny in the stomach, got up loads of times during the night, same problem. Said to my wife, this seems to be coming and going. I still feel like I can see blood now and again. Things aren't right. Went to see my GP. I had a telephone appointment with him where he asked me to go and get a blood test. So I went to Park and Ride in Cambridge at Newmarket Road to drive-through blood test, had that done. First blood test I'd ever had, so was scared about that. I had to do a sample, which I then took in. I went to see him, and this is, I suppose, the thing that I'd always been fearing about, is the having to go and have procedures that I was worried about having. He examined me in exactly the way I was expecting him to.
What, prostate examination?
Pretty much, finger up the bum. He actually thought I had a really bad hemorrhoid, was what he was saying to me. He had felt something, but he didn't think anything of it. And he said, it's probably nothing. I would like to get you checked. A couple of days after that appointment, he rang me to say, because he'd had the blood test results back, and a lot of things weren't that bad. So blood test was fine. I hadn't had any weight loss. Wasn't really feeling ill. There was a high blood count in the poo sample that I'd given. That meant he could speed up me going in for my colonoscopy, because before it was going to be over 2 weeks before he would get me in. And for some reason, I started to have a bit of a feeling there was something wrong with me, because during the course of those 2 weeks between appointments and going to hospital, I'd read a lot. And whether it was because I was more in tune to it or I don't know what, but I started to read things, and you start to go, I had that. And I hadn't really realised the changes, that the other things that had been going on. And you start to think, oh, there's more going on here than perhaps I'd realised. And I think I went in hoping it was nothing, hoping they were going to tell me. But I could almost tell during the procedure, because I didn't have any sedation or anything. So I was very aware of what was going on during my colonoscopy. And the guy doing it was frantic because the camera wasn't working, and he wanted to be able to take pictures, and he was getting very anxious about the fact that he couldn't take any pictures. I saw something quite weird on the camera myself very early, which didn't look right. It seemed very strange, but I didn't think anything of it because I've never seen the inside of a human body before, or a bowel. I actually knew before anyone told me that I'd got cancer, that there was something wrong, because the nurse before said, I'm going to wheel you into a recovery room, but the doctor would like to speak to you. They were the words, and I remember it vividly. And as soon as she said that, I knew that there was something wrong. And yeah, they wheeled me to the recovery area, and I actually burst into tears because I knew, without anyone ever telling me, that I'd got something wrong with me. And then a bit later, the doctor came to see me and told me I got a growth not actually that far up, so it was quite close to my anus, and it's not that far up. It meant I could have it operated and have a temporary stoma, so I was told that from day one. He also said that we caught it early. I didn't know what that meant in terms of the outlook, but he made a point of telling me that. But yeah, that probably happened all within about 2 to 3 weeks of April, from seeing the GP at the start around the 8th, 9th, 10th, through to probably the other side of an Easter weekend. So it's quite fast.
How did you tell your wife?
Very badly, because they asked me how I was being picked up, because they told me to get driven in and then driven home. And she obviously had my children. So I ended up having to ring her after quite a long time to tell her to come and pick me up. And of course, the first thing she says to me, "Is everything okay?" And I didn't know how to lie to her. I wanted to say, "Just come in," or find a way of saying it so she didn't know. But I just said, "Not really, just have to come and get me." So you could tell I never actually told her in the end, really, because I could tell from her picking me up, because she had the kids. I couldn't say anything in the car. We had to drive her home, and then I had to sort of get the kids in the living room, and I think we ended up going up to our bedroom so I could tell her properly what had happened. But she obviously knew there was a problem just from the way I was and the way I'd asked her to come and get me. We told the girls the same day. We had a chat and said we felt it was important to tell them. I was horrified about the thought of the word, scaring them, but we told them that I was ill, that I got cancer, but it was something we were going to treat, and that I'd basically been told something similar, but it was early and everything else, but I didn't know what extent I was going to have to go through, but we just felt it important to tell people. I drove to see my mum, which is probably the thing I was worried about the most, because obviously my dad had died and she'd had to go through pretty bad experience of that with cancer, and watched him deteriorate so rapidly. That was the one I was worried about the most, and it was horrible. But actually, in some ways, she felt quite relieved when I told her what the doctors had said, because obviously with my dad, everything was quite negative. She almost knew from day one with him that it was really bad. But because of the things that I'd been told, she said, "Oh, they never said that to Michael. That sounds positive." So after being absolutely devastated at first, she actually started to get some comfort from the fact that I'd been given some pretty good outlook in terms of my prognosis. It was actually when I then went in a few weeks later and met my surgeon consultant, Miss Davies, who sort of sat me down and went, "What do you know and what don't you know?" Told him what I'd been told initially, and he then clarified a lot of it for me in terms of what it was, where it was. There were a couple of lymph nodes quite close to the area, which they couldn't tell from immediate sort of scans, because I'd had to have a CT scan and MRI scan in between those appointments. They said we don't know 100% if it has it, but they assume it does, because it's better to be on the side of caution than not. So yeah, I mean, that was officially when I was told, was when I went in to see Miss Davies, who's the consultant surgeon that ended up operating on me.
When you spoke to the consultant surgeon and they were talking to you about, you're now talking to someone whose life is dedicated to treating your condition. Did it make you feel more empowered, like having the knowledge? Are you the sort of person, the more you know about something, the better you feel about it?
That's a really good question, and the answer is both. And I'll try yes and no, and I'll try and explain what I mean by that. I like to know what was going on with me. It was important that I understood, especially as actually a lot of what they were telling me was quite positive. When I saw Miss Davies the first time, he said the plan is for cure. Not we're going to cure you, because they can't say it in that way, but he said the plan is for cure. But in general, he said that put me in good stead, because I'd be young enough and fit enough to be able to undertake the treatment and the operation. And I was put on a reasonably aggressive treatment plan, where I had most of my treatment before my operation. So some people have it after the operation, some people have the operation in the middle, but I had all of my treatment prior to my operation. And he was pretty much told me everything that may or may not happen. His abilities, he's probably the most senior surgeon in that area. And it's not just about bowel cancer, but he does a lot of bowel operations. He's one of the senior members of the team, and everybody at that hospital talks very fondly of him, and it always makes me smile. But the way he explained things, the way he talked to me, put me at ease as much as everything else. The way he spoke to my wife, he didn't just talk at me. He acknowledged her, and he said, we're going to look after him. And he made a few comments like that over different things. But I didn't actually see him very much in the next probably 9 months or so, because I was handed over to other people who dealt with my treatment. And it's a shame, really, because he always was the one that made me feel at ease, and I had so much confidence in him. So my treatment was to have 5 weeks of radiotherapy, which I had to have every day. So I'd go in Monday to Friday, and then I'd have the weekends off. During that period of time, I also had chemotherapy tablets. So you get these sort of pink tablets. They look the same colour as a Percy pig. It's the best way I can describe them. I had to take a certain amount of those every day I was having radiotherapy. Radiotherapy is weird. It doesn't actually, you don't feel a thing. But I probably only spent about 6 minutes in the scanner having the radiotherapy. It's quite a strange thing, quite tiring. The treatment tires you out, but also going into hospital every day is quite tiring too, especially as I was working.
I was going to ask, what was it like working during your treatment?
Really hard. I'm quite conscientious with work. I work quite hard and long hours, always have done. And I felt guilty, I think, a little bit of the time I was taken out. They were very good about saying, you do what you need to do, go to what you need to do. I tried to just be positive, and I think a lot of people didn't think there was an awful lot wrong with me, because I was always going into meetings. It was very remote, so it was only ever on Teams, but I was always very positive about it. And it didn't really affect me in terms of, it never made me feel ill. I didn't get any scarring. I was warned about blistering on my stomach or mouth and feet. Nothing like that ever happened actually at any point in my treatment. I played football twice a week until a week before my operation. The only time I didn't play was the Friday after having chemotherapy on a Wednesday, because I didn't feel like I could. But I would always go back, and I'd always keep going. That was really important, actually, playing football. That sport was very good for my mental and physical well-being, I think. Doing normal things really helps just take you out of that bubble of feeling like you're a patient and that you're ill. Well, initially I was meant to have 6 cycles of chemotherapy. So I'd go in and have a drip for about 2 hours and have to take the tablets. I then had a problem because after about 2 weeks of that, I started to become unable to swallow the tablets. I don't really know why, and it was very mental. And a little bit of one of the things that oxaliplatin, the type of chemotherapy I had, is it affects you with cold. So almost instantaneously, I couldn't touch cold things. If I went to get something out of the fridge, I would immediately have to let go of it. It was just too much. It hurt. It was too severe a sensation. Like cold air would get into my throat and I would lose my voice. I couldn't talk. And I remember going into the car park and it was so cold in there after I'd left the hospital. I went to say something and I couldn't get my voice to work. I think that throat sensation, plus it would make me get saliva, my taste changed a lot during that. I started to gag taking the tablets and I couldn't get them down. I then ended up having it changed to a PICC line. So I was having, instead of tablets, I had it through a PICC line, which meant I had 9 cycles. And instead of having it every 3 weeks, I was having it every 2. And that's meant I probably went a month longer with my treatment. That I should have been done by the end of November. And I ended up having my last chemotherapy session the Wednesday before Christmas. My surgery could have been done keyhole surgery. They can do that type of operation on the bowel through keyhole surgery, but because I had to have lymph nodes removed and some blood vessel work done, I actually had open surgery. So I've got quite a big scar going all the way down. They took out the tumour, stitched my bowel back together, removed 12 lymph nodes, 2 of which were confirmed to have had the cancer in it. But the most important thing was I had blood vessels tested through the biopsy. And because there was no sign of cancer cells in the bloodstream, they were confident enough not to make me have any more treatment. So I've not gone back on to any treatment now, post-op. It took me probably 2-3 days of getting in and out of bed before I could do it without screaming. it really hurt across my entire stomach, but not probably as much as I thought it was going to. I actually got told off once for not squeezing the morphine button enough and giving myself enough drugs. So I was coping with it pretty well. I got up the following day and I could barely get myself out of bed, but moving is crucial. I would walk up and down the ward just to try and get up and about, and I think I got better quicker because I forced myself to be active, even when I went home, which was after about a week. And obviously I've got a stoma now, and a temporary stoma, which takes some adjusting to. It's another thing to have to get to deal with and learn. Having gone through all the treatment, there was another thing to have to adapt to. I hate it, I'll be very honest. I don't like the way it looks, I don't like the way it is, I don't like the noises it makes and embarrasses me in front of people doing, but it's a necessity of what I had to do to get better. And thankfully for me, I should be able to have it reversed, which I know a lot of people don't have that fortune. So I might grumble and complain about a lot of things, but I also have seen a lot of people who were a lot worse off than I was. So yeah, that's something that I hope to have fixed at some point this year.
You're the person in your family with cancer. Mm-hmm. You're the one having treatment.
Yeah.
You're doing something about it effectively. Mm-hmm. The people who are your nurses, the doctors, they're doing something about it. Do you think sometimes in these situations it's, you know, your wife and your children are the ones who are the most helpless?
Absolutely. They probably more the girls, because I don't think anybody ever really asked them. They didn't really ever talk to us about it. There was very few times where they seemed to want to ask what was going on, and maybe that was them shutting themselves off from it a little bit. Me and Leanne always used to ask them now and again questions, but they never really did. The one time my eldest daughter asked me a question, I wasn't prepared for it because she hadn't really said anything. And then one day she just said, "What happens if they don't get you treated properly?" And obviously that's quite a big question that I just wasn't ready for. But again, I was trying to be honest with her. I just said, obviously everything they're doing is to make me better. If it doesn't work, it isn't a good thing, but we'll try something else. I never said at any point about dying or anything like that, because I'd never been given any suggestion to say that that was going to happen. There's always risks with things spreading or operations, things like that. But that was probably the toughest thing, was knowing how to get the kids support if they needed it. My wife got it weirdly did get the support from other people as much as me, but in a different way. She actually works at Addenbrooke's as well, so she was able to come up and see me. So she felt part of it because she was able to very easily come up to the ward, say hello to me during all of my treatment. I was waiting one morning and there was me, another lady and a guy opposite. We were chatting, and then later that day when I left the chemotherapy, came out, my wife was there to take me home. To see me, and she was chatting to a lady next to her. That lady was the wife of the guy who was sat opposite me, and that lady also works at the hospital, and those two speak to each other pretty much all the time about how we both have been getting on with our treatment, and a bit like I was chatting to other patients, she was talking to other spouses and partners of patients. That little community, I think, is quite cool when it works like that and you get to meet people. But you're absolutely right, I got a lot of the attention, but on the flip side of that, I also didn't. I think a lot of people often used to talk to Leanne about it more than they used to talk to me, probably because they were worried I didn't want to talk about it, or maybe they didn't want to hear what I had to say. But I actually found that people often would ask Leanne about how I was doing, or my mum actually sometimes, more than people actually would ask me. I think people find it difficult to know, and it's something I've noticed a lot, is that some people are really good at reaching out and some people aren't. I was quite hurt by it at times, but I got to a point where I realised everybody has other things going on in their lives. I'm not the centre of everybody's world, and I think some people find it really awkward to know what to say and how to say it. I've had a lot of people say, I've been meaning to speak to you for however long, but I've also learnt that if I know somebody's going through something, I don't hesitate to get in touch now, because it's really important to try and support people as best you can. But it took me to perhaps go through this to realise how, because I know I'd be one of the worst at doing it, but I won't now. because I know how it's nice to have people just ask.
This is going to sound like a really strange question. Has it in some way enriched your life, what you've been through? Do relationships mean more? Do certain events, are you like, do you make yourself present for things?
Yeah.
Like, wow, this is happening now. I want to enjoy this as much as I can.
Yes, I hope so. And I hope I never become blasé to life anymore. I do definitely try and be at things more, albeit that is still hindered a bit by the fact that there were certain things that I couldn't do for a long time. But for all that my diagnoses were good, there was always still that fear in the back of my mind that it could get worse, it could spread, something bad would happen. At times I was quite pessimistic, probably more than I should have been. I remember getting told about a lesion on my liver, and it turned out to be from the chemotherapy and not that the cancer spread. But for a week I didn't know that. And I was in bits thinking, oh my goodness, it spread. And I did. I can't lie and say there weren't times I worried about my own mortality and thought it was going the wrong way. It definitely has enriched my life in terms of the way I think about things. I was not ever actually worried about myself or scared of dying or anything. It was more about the kids. I didn't want to leave them behind. I want to be able to support them for as long as they need my support, especially as their children. The thoughts I had crossed my mind was, I want to be able to pay for them to do this, that, the other. I want to be able to be there for their weddings and things. If I'm going, I want to go knowing that they're going to be okay, that they've got families of their own. It was things like that I think affected me. So now, of course, I'm always like, we need to live our lives. It's a bit cliched about you should always live life to its fullest because you never know, the next day might never come type of thing. But that starts to cross your mind a little bit, is that I've probably not done things thinking, oh, there's always time to do that. And it is a bit of a shot in the arm to make you go, live life to its fullest, do things you always wanted to do. And I am. We need to do more things to enjoy life as it is now. The kids being the age they are, or us being young enough to do stuff. My perception on that has definitely changed, yeah.
If anyone's thinking about putting it off or they're worried, what would you say to them?
It's very easy to just sit here and say this, but I was there. I was in that. That was me. I put it off for about 4 months because I was scared of the procedures. I was scared of having things done to me I didn't want to have done to me. I was scared of being told I've got cancer. All those things have happened. I was told, I've had all those procedures, I've had all those things. But it's worth it because hopefully I'm okay now and hopefully I'll go on to live plenty more years. If I hadn't and I'd left it longer, all that was going to happen was it was going to spread and it was going to get worse. And, I could have been in a far worse position. You've just got to go. Chances are, and if you watch anything, read anything, there is as much likelihood that it's not anything serious and that it could be anything at all that isn't cancer. But if it is, it's very much better to get it early. So yeah, it's one of those things where I can understand because I was that person, but my biggest message I could ever give to someone is don't put it off. If you see something, go straight away to your GP. Because if it's good news, you'll be relieved. And if it's the bad news, then at least there's a much higher chance that you're going to get better. So yeah, I understand, but for goodness sakes, just go and see your GP. Don't put it off. It's not worth it.
Hello, I'm David Macmillan. I was a smuggler for nearly 40 years, and that involved prison, which I took on the chin mostly, but sometimes it just doesn't work out. Bangkok was one of those. Execution, or near enough to it, 2 weeks away, and that meant, when it comes to prison, escape.